I'm Matt Cantlon, one of the hand, wrist, and elbow docs over at ONS. I'm going to talk to you a little bit about safety of wide-awake surgery. So wide-awake surgery in and of itself could be a whole day-long conference on how it's done, benefits of it. We're really going to focus very, very briefly on what it is in case anyone hasn't been exposed to it before or heard of it, and then some of the safety benefits of wide-awake surgery, and then a brief bit on some of the safety concerns, because everyone's mentioned there is no free lunch. So what is wide-awake surgery? So wide-awake surgery is surgery where patients literally walk right in the door. They drive themselves right to surgery, walk in the door. We inject local anesthesia in the area that surgery is going to proceed in. And then patients go to the operating room completely awake. No sedation, no general anesthesia. They're awake, they're alert, they're talking. They're not having any pain during surgery. And we proceed with surgery on their hand, wrist, or elbow while patients are completely awake. And then at the end of surgery, patients can quite literally get up off the table, pick up their jacket, pick up their bag, walk right out the door, drive themselves home. So it's really been a big change in how upper extremity surgery has been performed over the last decade or so. And that was highlighted by this New York Times article that was fairly recent about this growing trend of wide-awake hand surgery. So let's talk about where some of these benefits lie, and we're really just going to touch on the safety benefits. There are a huge number of benefits in terms of expenses and cost and all that other stuff, but today we're really just going to focus on some of the safety benefits. So what are some of those safety benefits? So I break those down into preoperative, intraoperative, and postoperative benefits. So let's start with some preoperative benefits. Number one, patients no longer are getting a sedation or an anesthesia. So as a result, they don't need a preoperative medical clearance. Preoperative medical clearances are a clearance to ensure that a patient is safe enough to undergo an anesthesia. So we're getting rid of an anesthesia. Patients no longer need a preoperative medical clearance. That means fewer trips to the hospital. It means fewer trips to doctor's offices, less chance to be around other sick people. It's flu season coming up. You want to spend as little time in a hospital or healthcare center as possible. No preoperative testing because there's no preoperative medical clearances. We've reduced all that radiation exposure in chest x-rays that we used to get on almost everybody. We reduce any risks of pre-op blood draws. They're minimal, but some people get redness, pain, hematomas, very rarely infections from pre-op blood draws. We now are completely eliminating those. Patients don't have to fast prior to the operating room. Fasting prior to the operating room is to prevent any aspiration or aspiration pneumonias that might come from having a sedation or a general anesthesia. Patients can come right in, they can have lunch, they can have their cup of coffee in the morning, which is important to almost all of us, right? And we can still go right into the operating room. Importantly, in addition to the fact that patients don't have to fast, patients can take all of their normal medicines. This is really important for diabetic patients who have trouble controlling their blood sugars. So they can eat their normal breakfast, take their normal insulin, take all their normal medicines. There's no confusion over what medicines can I take, can't I take before surgery. You just do everything like it's your normal day. Let's talk about some of the intraoperative benefits. So because there's no sedation, there's no risk of any of the intraoperative or postoperative complications associated with sedation. Now, most of these are extremely safe, but we've all heard in the news as well, maybe had friends who have had complications of even a minor sedation procedure. Some of those risks, aspiration, so we've eliminated that risk. Especially after orthopedic procedures or any sedation, there's risk of falls. Falls on the way to the car from the operating room, falls on the way from the car to your home, falls in your home that night. That all goes away without any sedation or anesthesia. Nausea and vomiting is one of the most common complications after sedation. We often are giving more medicines after the anesthesia to help prevent the nausea and the vomiting. And then lastly, again, we all probably have heard of people who weren't able to pee after their sedation or their anesthesia and have to go home with a leg bag then that can often be there for a week or even more. And so we've also eliminated that risk. Because there's no sedation or anesthesia, we're able to treat patients who are otherwise not healthy enough to get cleared for normal surgery. So there's all sorts of risks with cardiac and elderly patients who already have some cognitive decline that could worsen with a sedation or an anesthesia, and we completely eliminate that and are able to now perform surgeries where those patients might not have been able to get them before. Those were kind of direct to any given patient benefits, but how about to our healthcare system as a whole? So one great study looked at the amount of non-operative time in the operating room for any given patient who was undergoing wide-awake surgery, and that was compared to sedation, hand surgery with sedation. They found that the time in the operating room that was spent not operating for any given surgical case was decreased by almost 16 minutes by proceeding with wide-awake surgery as compared to with a general anesthesia. And so that's a savings of 16 minutes of operating room time, operating room resources, which allow those resources to be used to people who really need them and create a safer overall healthcare environment for us. Lastly, how about environmental safety? So the bag on the left you see is the trash that's created with a typical carpal tunnel release surgery. It's a 12 to 15 minute procedure. That's a lot of trash. 500,000 procedures are performed per year with often that amount of trash being generated. And while despite people who are moving to wide awake haven't all moved towards decreasing the amount of supplies used during surgery, the bag that you see on the right is what is possible with wide awake surgery and much less gowning, draping, etc. Postoperative benefits. So perhaps the most important postoperative benefit is that performing surgery with patients awake allow us to perform surgery better. So what you're seeing now in the video is a trigger finger release. A trigger finger is when a finger gets stuck because there's an inflamed tendon that's getting stuck within the sheath of the finger. We're now able to perform that release, and patients are able to actively move their finger to allow the surgeon to understand that we've fully released and there's not going to be any recurrence or the release is complete. If you see on the video on the right, this is a flexor tendon surgery. So this is performing a flexor tendon repair. The patient's completely awake, and now we're able to ask them to make a fist during surgery. We're able to check the repair, make sure that there's no gapping of the repair, and wide awake surgery for flexor tendons have significantly decreased the rupture rate post-operatively by doing it in this manner. Lastly, in terms of postoperative safety, there's improved post-op pain control by performing the surgery wide awake. And as everyone has seen, it's all over the news. It's in 60 Minutes. It's in our news articles. We even may have friends or family or patients who have had problems with opioids. There's a huge opioid epidemic in this country. And wide awake surgery has the ability to decrease the amount of opioids that people are taking post-operatively. This was a great prospective study that came out of the Rothman Institute that looked at carpal tunnel release surgery that was performed wide awake and carpal tunnel release surgery that was performed under a sedation. And they looked at postoperative pain control. And they found that patients who had the carpal tunnel release wide awake required fewer postoperative narcotics, more commonly used no narcotics. By about 60% of people took no narcotics and 40% needed narcotics in the wide awake surgery. And most of them take narcotics for less time postoperatively, so less duration after the surgery. This was also a recent study out of the Rothman Institute. This is the highest level study that we can do. It's a randomized controlled trial. And it looked at carpal tunnel release that was performed wide awake. And that patients were given either Tylenol postoperatively, ibuprofen postoperatively, or oxycodone postoperatively. And it found that patients who underwent wide awake carpal tunnel release had better pain control with Tylenol and ibuprofen versus oxycodone. So we have the ability to significantly decrease the number of opioids, and we're actually moving towards really not needing any opioids after a lot of common hand and upper extremity surgeries. So what are some of the concerns about wide awake surgery? So one concern you might say is, well, patients aren't getting an IV, they're not getting any IV antibiotics. Are there any concerns for infection? So that certainly we would think that would be a concern. Huge studies have shown that preoperative antibiotics are no longer necessary for clean elective upper extremity surgery, particularly a surgery that doesn't require any hardware, pins, plates, screws. And so even patients who are undergoing a sedation for these procedures, the new recommendation is they don't need preoperative antibiotics. Other concerns. So patients can often get jitters or shakes after an injection for wide awake surgery. That's because the anesthesia that we use has a medicine called epinephrine in it that allows the blood vessels to be constricted. As your body uptakes that, it feels like we've had an extra cup of coffee. So some patients might feel a little bit jittery. Vasovagal fainting, that's not specific to wide awake surgery. Some patients just with needles just don't like needles. Most of us don't like needles, and there can be vasovagal episodes. And lastly, is there a risk of digital ischemia? So we're injecting epinephrine, we're injecting it in fingers for a long time, for 80 years. That was a no-no, and over the last decade, that's been shown to be very, very safe, but we're still certainly cautious in certain patients, particularly ones who have ever had a replant, Berger's disease, vasospastic disorders like Raynaud's disease. So is wide awake surgery safer? This is almost a no-brainer. Absolutely, the answer to that is yes, for preoperative, intraoperative, postoperative benefits that I mentioned. Thanks very much for your attention.